Kate joins us now, and Kate, I want to ask you, what's the scariest part about having this?
The scariest part for me right now is the fear that this will continue to progress until I have it all day, every day. I've spoken to a lot of people online who have it at that point, and they lose their jobs, their relationships. I've spoken to many people contemplating suicide, and even some will ask doctors to perform surgeries that will make them deaf.
You know, are you having it right now?
I actually just went in my right ear right when you asked me that. Yeah, probably because my head is turned this way.
So as you're talking to us, you're hearing that echoing sound.
That's correct.
Drew, explain a little more of what this is.
Well, it is, and it has to do with the eustachian tube. And as we know, the eustachian tube is that tube that starts in the back of your throat, back of the nasal cavity. The idea being that it allows air to go in to the middle ear space.
This is what you were looking in when you were in her
Yes,
house.
I was looking into her ear through here, looking at the eardrum while she was blowing air, forcing air into here. I saw the eardrum right here moving because of an excessive amount of air going in. And, you know, we're talking about eustachian tube dysfunction, particularly in kids. We've all had that sensation of popping ears, of clicking, of gurgling. And that has to do when your eustachian tube closes down. But in Kate's case, her eustachian tube is in an open position more than normal. So everything, all those sounds, chewing, breathing, because you know you're breathing in through the nose, that's going right into your eustachian tube and is being transmitted in turn to the middle ear space and the inner ear.
And that, of course, begs the question we haven't talked about on the show before: patulous.
This is the first time we've discussed it. And that is Kate's diagnosis: patulous eustachian tube dysfunction.
So what?
Yeah. So is there anything that can help her?
There are some treatments that are available, things that will help to close down that opening. There's drops you can use. They've talked about using estrogen drops through the nose. For some reason, have the effect of closing that down. Other preparations you can take by nose, and then otherwise, you know, the ear, nose, and throat surgeon goes in and manipulates that opening, injecting something to try to close it down.
Well, Kate, Dr. Dennis Poe is an otolaryngologist at Boston Children's. He is a leading researcher looking at new studies for advanced treatments of this condition. He actually has agreed to see you and evaluate you. And if you are a good candidate for one of the newest procedures, he's agreed to perform it on you if you want.
No, we've researched this. This is a rare condition. And he is one of the few true experts that's researching, as Dr. Travis said. We're putting you in the best hands. I think you'll see some results.
That's great. Thank you so much.
So please, Kate, keep us posted. Dr. Poe, we want to thank you for helping out.